Hi, my name is Bailey Hubacher, and today I'll be talking about prescription drug abuse and pharmaceutical industry corruption and how they relate to one another. 50 Americans each day are dying from prescription drug overdose, and 100 Americans each day are being admitted into emergency rooms for prescription overdose. It should be no surprise then that Americans account for 80% of the world's supply of painkillers. In fact, Americans consume 40% of prescription drugs in the world, despite only making up 4 to 5% of the population. Tim Carden, agent in charge of the Drug Enforcement Administration, said that the biggest drug problem in America isn't meth, heroin, cocaine, or some other mysterious substance. It's prescription drugs. Donald Schley says there's an unlimited supply, and he's right. The unlimited supply plus easy accessibility makes prescription drugs easy to obtain. Data shows that physicians write about 4 billion prescriptions each year, just alone in America. 72% of prescription drug abusers were either prescribed by a doctor or taking them from family members or close friends. The main prescription drugs that are abused are opioids, which are painkillers prescribed commonly to treat pain, central nervous system or CNS depressants, which treat anxiety or sleeping disorders, and stimulants, which are prescribed to treat ADHD. Why doctors are prescribing drugs when they don't need to be then becomes the problem. The corruption taking place within the pharmaceutical industry is putting drug safety second to profit. Donald Lay, Joe Lexon, and Jonathan Darrow explained that the corruption in the legislative process, production of medical knowledge and practice, and medical marketing contribute to prescription drug abuse. The relationship between pharmaceutical firms and physicians creates a huge conflict of interest, resulting in harm to the patient. This leads to improper dependencies as a source of corruption. Paul Jurgensen shows that legislators have become financially dependent on drug company contributors. Rather than representing citizens, legislation often serves the interests of pharmaceutical firms. Lisa Coggrove and Emily Wheeler express how organized psychiatry has become dependent on pharmaceutical funding and that has corrupted the development of psychiatric diagnostic categories and guidelines. The American Psychiatric Association receives millions from advertising and grants. APA publishes Diagnostic and Statistical Manual for Mental Disorders. Researchers have financial ties to drug firms, even as they conduct clinical trials and guidelines to prescribe these drugs. The conflict of interest compromises the judgment of physicians who conduct and interpret studies, develop diagnostic categories, and draft practice guidelines. In an ideal world, physicians would prescribe drugs based on knowledge of their effects and not primarily due to pharmaceutical promotion. Most physicians consider themselves to be rational and objective, and consequently fail to recognize how susceptible they are to commercial influences due to self-serving bias and rationalization. Many pharmaceutical firms often apply principles of social psychology to influence physicians' judgments. Pharmaceutical firms have been known to abuse their power for their own financial gain. They often use physicians as key opinion leaders. These opinion leaders often find it difficult when giving clear medical advice and diagnostic, due to the fact that the pharmaceutical firms fund a lot of their practice and guide their view on medical knowledge. Their abuse of power is often seen through the off-label or non-prescription drug abuse, which is the use of prescription drugs that were not prescribed for an individual by a physician. Off-label uses show the incentive firms have to prescribe drugs for uses the FDA has not approved. It worsens the balance of harm and benefit. It is profitable for manufacturers, and it thrives because the pharmaceutical firms ignore the problem or encourage the practice and profit from off-label sales. Opioid prescriptions reached 210 million in 2010. ADHD prescriptions went to 45 million. Doctors write out 50 million prescriptions for benzos each year. There were 38,329 deaths due to drug overdoses, and 60% came from prescription drugs.
created using Powtoon.